It was a very interesting story that was in the news, I think last year or the year before that, of a certain young man, I think senior 4, walks into the exam, goes blind, then comes out, and then he can see again. Then goes back into the exam, and again he can't see. Then comes out, they take him to the sick bay, they pray, suddenly he can see again. No. He was failing to cope with the normal stress. In primary school, I was in a mixed primary school, and I think from around P4 or P5, I think P5, P6, there'd always be those sessions where they would call the girls aside. Yes. Right? The girls had to go and speak to the senior woman or something like that. And I never know what they were talking about. No one tells us what they do. But they would go. I think it would happen every 2 weeks or so. The girls would go and talk to the senior woman. Yes. What happens for the boys during that? Go and play football. When my wife and I were getting married, every other week, she's going, Auntie so-and-so has called her to go and talk to her. Then Auntie so-and-so. Then these friends have organized a baby shower. Then those friends have organized a bridal shower. So, and it's a whole... Right? I was talking to you. If I showed you an MRI PET scan of someone who has severe depression and someone who doesn't have it, actual changes. Oh, really? Even, this is an illness. Right. It's a biological condition. I've met people who've been, battling depression for years. They probably come to the hospital for something else. And then realize, but wait, you're actually also depressed. And I give you medication. They come back after 2 weeks and thinking, how is this possible that I've gone this entire time without knowing that I could have gotten treatment? The government does provide psychiatric services free of charge, right? At the Butabika Mental Health National Referral Hospital, free medical services, free psychiatric services are available. In Mulago at the Boston Mental Health Clinic, free medical, free psychiatric services, free of charge.
When it comes to mental health, there seems to be a big difference between wellness and illness. Welcome to today's episode of Originaires. I'm here with Dr. Agaba Denis, who is a psychiatrist, and is going to help us debunk a lot of the myths or a lot of the things that we may not really be sure of about mental health. And I'm really, really, really excited to have this conversation because it's something that is shrouded around a lot of myths, around a lot of impressions that people have. So yeah, thanks for making the time
I'm excited to be here. I've been looking forward to it. And thank you for having me and for inviting me to come.
Okay, what is mental wellness? Let's just kick it off there.
I think it's important for us to first and foremost understand what the mind is, because mental wellness, mental refers to the mind. What is the mind? This thing that we want to do well, what is the mind? And the mind, is one of the faculties that we have. Okay, so if you think about your heart, your liver, your lungs, there's this thing that you have which is called the mind. And the mind is responsible for how you think, responsible for how you feel, responsible for how you behave, or how you act. Primarily those three things form this faculty that you have, which is the mind. And that's what we want to do well, right? So mental wellness really refers to a healthy mind. And that is something that all of us have, and all of us should be working to keep healthy. Oftentimes we think of the mind and the brain as one thing.
Are they not? I'm yet to be corrected. I thought they were.
I could borrow from the world of medicine, right? So there's a very big distinction between neurology, the neurosurgeons, right? So you have the neurosurgeons. They handle the brain.
Right.
So the neurologists also treat disorders of the brain.
Yes.
And then you have the psychiatrists. They handle the mind. If they were the same, why would you have two different disciplines?
Okay, the way I'm thinking about it, especially as a content creator, software versus hardware.
Exactly.
Okay.
And you have hardware, hardware developers and software developers, hardware engineers, software engineers. So they're not the same. But indeed, I mean, think of Samsung and Android. Samsung is not Android. Android is not Samsung. But of course, they work
together,
right? But the two are very different. So yeah, the brain is not necessarily the same as the mind. There's two different faculties that you have. And that's why they have two different disciplines. In the world of medicine, the disorders that affect them are very different, and how they are managed is very different. And what they are primarily responsible for is very different. Much as, of course, there's a lot of interlinkage, as we will discuss. But yeah, so this mind of yours that you have needs to be healthy. The way your heart has to be healthy, the way you talk of gut health, the way you talk of health, the way all these organs of the body should be healthy, that's the same way that your mind needs to be healthy. And so mental wellness simply refers to a healthy mind.
Yeah. I mean, there are a lot of things that people deal with on a daily. How do you know that you are well, like you are mentally well?
Yeah.
Is it just being functional in society, or is there more to it?
Very good, very, very good. So I just want to read from the World Health Organization, and they have a very nice definition or classification of mental wellness. So how do we tell that someone is well or is healthy? Wellness and health tend to be used interchangeably. Because if you're healthy, then you're well. Now, the World Health Organization has a very beautiful way it defines health. So I'll start with health, then I'll come to mental health and mental wellness. And it defines health as a state of complete physical, mental, and social well-being. And not merely the absence of disease or infirmities. So it's not enough not to be sick, right? You have to be complete physical, mental, and social well-being. That's what health is generally.
Yeah.
Now, from that bigger bracket, they then come down to mental health. So this is how they define mental health, and I think it will paint the picture very well. So a state of well-being in which an individual can realize his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and can make a contribution to his or her community. So that's how we tell that this person is healthy. Yeah,
that paints a picture.
Can you work?
Right.
Can you realize your abilities?
Yes.
Okay, so think of a tennis player, right? So their ability is to play
tennis. Yeah.
So if they are able to play their tennis well, then they are. If for whatever reason they are not able to play the tennis well, right? Then that person is mentally unwell.
Right.
They may not be ill. So we're going to talk about illness.
Yes.
But they're mentally unwell. Yeah. Right? So we were speaking earlier about COVID, the pandemic. One of the things that the pandemic did when we went into lockdown was for many people, we couldn't realize our abilities. Right? If I am a taxi driver and now
you're home, you cannot.
Cars aren't allowed to move.
Yes.
So I'm not able to do the thing that I know how to do. I'm just not going to be myself, not mentally well.
Right.
Again, that's why there was this big during the pandemic. People think about mental health things. But because one of the things that was clearly affected was people's ability to work productively and fruitfully. Right. So these are the things that can tell whether someone is mentally healthy or not. Yeah. So are you able to work productively and fruitfully? Are you able to, again, on this point, you've had those situations. You're in the office, someone's in the office, like he's there, clocked in on time.
Not there.
But when you think of how much work have you done today?
Yeah. I have a memory. There was a day I was there physically. Nothing productive happened because, I was in my head the entire time. Yeah.
Right? So clearly this person is not well. Are they ill? No. But they're not well.
They're not well.
Okay, because they're not able to work productively and fruitfully, right? Coping with the normal stresses of life. Well, life is stressful.
Yes.
That's a given. It's bound to be. There's going to be challenges here and there. But ordinarily, we should be able to cope. Right? The one thing about the human being is adaptivity. We have the ability to adapt and to cope with any situation. So if you're failing to cope with the normal sources of life, then you're not well, right? I like to use the example of, because this is exam season, right? And my office has been busy during exam season because exams are stressful, literally. But some people fail to cope. Right. So you've heard of the stories, went into the exam and couldn't write. Failed to write. It was a very interesting story that was in the news, I think last year or the year before that, of a certain young man, I think senior 4, walks into the exam, goes blind. He can't see.
I think I remember that story,
Then comes out, and then he can see again. Then goes back into the exam, and again he can't see. So he comes out, they take him to the sick bay, they pray, suddenly he can see again. He was failing to cope with the normal stress. His exams. It's something all of us have had to go through. But he's not able to cope. That means he's not well. He's not mentally well. Right?
Just to touch on like that bit about coping, I've always had a suspicion that like Uganda's addiction problem or Uganda's drinking problem is just kind of like a mass coping mechanism that people are just like, you know what, things are not well, but like, let me at least enjoy myself in this one way. I don't know if that has any connection.
To a large degree, yes, because our understanding, for example, of addictions, now, there's a difference, and I'm not here to try
and vilify
the bar scene and enjoyments. I think they're very helpful. Actually, one of the things that we encourage is precisely that. Go catch up with your friends, have a good time.
Definitely.
Alcohol in and of itself is not evil, it's not wrong. Of course, it goes down to how much you consume, etc., etc. But many times, again, when I fail to cope, then the body resorts to now these defunct coping mechanisms. Addictions. Right now, the big thing we're seeing now is social media. From doom scrolling, as they call it. I have something that I'm failing to
get away from,
and then I run to something else to sort of help me cope. So yes, for some people, they are using alcohol and the bar as a very defunct way of coping. So, for example, if I have an argument with my wife at home, or there's a situation, rather than go and face the situation and deal with it, I'm going to go
and go out until like 3 in the morning
when I'm sure she's asleep, and then come home. I'm not really fixing the issue. I'm failing to cope with the normal stress that is living with someone else. Ideally, there should be better ways to cope, but if I fail to cope the right way, then I end up with a defunct coping mechanism. Coping in itself can be healthy or unhealthy. So there are good ways to cope, there are bad ways to cope, right? And so I wouldn't agree 100%, but yes, for some people, they're using this to sort of escape the reality of the stress that has to be dealt with, which then becomes very unhealthy.
Okay. You are still continuing breaking down the parts of that definition.
Yes. Coping, so realizing abilities, coping with the normal sources of life, working productively and fruitfully, and then making a contribution to your community. And I think that's something which at this point we have to, because November usually mental health and all, and it's a big concern for many men. If they're not able to provide, you're not able to make a contribution. That tends to take a big toll on them, right? Or one way you know that this man is not well is when he's not able to provide, right? And I think for a long time, that is easily brushed off as weakness. This man is just useless.
No, he's not man enough or something like that.
It's very possible that he's not well.
Like
he's not able to provide because he's not well.
Can we stay there for a second? Because I feel like men's mental health is something that's so, I don't know, hard to navigate, because I think from just speaking broadly, women are more likely to like seek help or like talk to their people and, you know, reach out when they're not fine. But men are either because of society or because of whatever reasons feel like they have to hold it in, feel like they have to have this facade of like everything is fine. How should they be able to manage?
I think first of all, I don't agree that men can't do this thing or don't do this.
Yes.
I think it's again goes back to the cultural setting in which we are and how men are raised. One of the beautiful things about the work that I do is we don't look at things in narrow context. We look at the broad view of things. So if I were to speak with a client, I don't talk about the last 30 minutes. We're going to talk about the last 30 years, right? Because many of the things that are going to cause you distress probably began many
childhood,
years ago. So if you think about most of the men and how they're raised, already from when they're very young boys, they are being ingrained into
don't cry, don't do this. Yeah.
So what you're seeing 30 years later is not something that they're just waking up and saying, today I'm not going to talk.
Yeah.
No, it's because from back then, it's a thing. I like to share this story. Primary school, I was in a mixed primary school. And I think from around P4 or P5, I think P5, P6, there'd always be those sessions where they would call the girls aside.
Yes.
Right? The girls had to go and speak to the senior woman or something of that. And I never know what they were talking about. No one tells us what they were. But they would go. I think it would happen every 2 weeks or so. The girls would go and talk to the senior woman.
Yes.
What happens for the boys during that? Go and play football.
Right. I thought you guys were also having your own conversations.
Which conversation?
Nothing.
That was go and play football. So no one is stopping to talk to you.
Right.
No one wants to ask you any questions. For it was good, go play football.
It's like the stereotype that it's easier to raise boys.
But why? Because we don't talk to boys, right? We have expectations of them. No one stops to talk to them. Girls, on the other hand, there's an elaborate way in which they are brought up, right? Come, we teach you how to cook. Come, we teach you. What are you doing in all that? You're talking.
Talking, absolutely.
You're talking to the girls.
Yeah.
Girls dress like this. So you're talking to the girls. So what you're ingraining in them is these are things we have to talk about. We have to talk about these things. Senga is going to call you aside to do what? To talk to you. I like sharing this experience as well. When my wife and I were getting married, every other week, she's going, Auntie so-and-so has called her to talk to her. Then Auntie so-and-so. Then these friends have organized a baby shower. Then those friends have organized a bridal shower. So,
and it's a whole...
Right? Who was talking to them?
They weren't saying, okay, now...
They just pulled me aside to say, now let's talk. Marriage, this is what it is.
Really?
So she has all these people that say, hey, we have to talk about this. I need to give you advice. We have to talk. For me.
So wait, the bachelor party is the party.
Just go drink. They're not talking about bachelor party. Just go and drink. The one person who called me aside, one of my uncles, he's a good friend. My mom's brother. So he called me aside like, do you have money? That's what he asked. Do you have enough? Can you look after the gap? Beyond that, go.
But there's more to it than
30 years later and say, but why did you talk?
You don't even know how to. Step one,
no one talks to me.
Right.
Two, no one has ever asked me directly to talk to them about this or that.
It has never been the MO.
You punish every time you do something wrong. You punish. There's no, especially for boys. Really, many times it's punishment. When you do something wrong, you're punished. And yet no one has taught you how to do it right in the first place. Right? It's just don't do that. Don't.
Not even why what you did was wrong.
How do you do it better?
Yeah.
You're just punished, right? Gotcha. There's a culture of punishment, which is not very helpful.
Yeah.
So I think really when you come down to that, it's for many of these guys, they're just not being equipped with the skills that they need. And then eventually as they grow older, they just remain. Yeah. But it's not that they can't. It's just something that has to be deliberately done. You know,
something I find fascinating is how I see a lot of like guys being hammered in the idea that you're not supposed to cry as a man, you can't cry. And yet for me, as a very sensitive human being, I love a good cry. Like sometimes if everything is overwhelming or everything is, whatever, there's a release that comes with it. And in my head, I feel like, correct me if I'm wrong, like I feel like it goes with like some of that whole, like that energy comes out. And then afterwards I'm like, okay, that's done. Let's start over. Let's see how to tackle.
I agree with you, right? And it's helpful. It's very cathartic to express emotion. But there's many ways to express emotion. It's not all concluded in cry. Right? So I don't think we also have to understand that even biologically, men and women are different, right? So women are more, and I use the word more, right? Because people tend to think it's A and B. No, I think it's a spectrum. Women tend to be more emotionally expressive. Men are emotionally expressive,
but
just
differently.
Much to a different way, or they will express it in a different way. So it's not like we are, on two separate wavelengths. It's just different amounts of.
So is the guy who goes into like his gym era after a breakup, him like
that's probably a way of expressing. Is it healthy? As we're going to see it.
Yeah,
it's very healthy as well to exercise. One of the key things. It's also healthy for him to talk. It's also healthy for him to, vent and things of that particular kind. Should it include crying? Maybe not necessarily. Because different. For some people, yes, maybe a cry is what's going to work. But then for someone else, it will just be let's sit down and have a chat, or let me go on a trip.
Why I kept harping on the crying thing is because as kids, as babies, when the stakes are leveled, young boys cry when, they feel pain, when they feel this. But I feel like that's one trait that is like very specifically trained out of them. And I feel like it's such a societal thing. And yet it's a physiological reaction. I worry that it might be one of the things that just disconnects.
Interestingly, I have a boy and a girl. Okay. 2 kids. And it's amazing to see them grow. That even instinctively, they drift towards different things, right? So much as there's been that push to sort of don't, do, even without any necessary intervention, they'll still drift.
Gotcha.
Separate things. I think for me, what I really like to push is the individuality. Not two people are the same. There are girls who don't cry. That's the bad thing.
That's true.
Right? There are boys who do cry. The bad thing. So I wouldn't emphasize cry as the solution. I think find your way.
Yeah.
And my way may be very different from your way. And your way may be very different from your best friend's way. Right? So I think to really depart from the thought that all of us might fit in this one nice, neat box.
Right.
It's going to vary. And if it's healthy.
Yeah. Okay.
So if it works for you, perfect.
Yes.
Right? Yeah, but if someone else doesn't do it, they are not strange. Right? I think we shouldn't sort of force them to do something that may not come naturally for them.
I hear you. Yeah. Okay. There was this bombshell headline that when we talk about mental health in Uganda, everyone kind of refers back to that the 14 million people in Uganda are mentally, ill to some extent. Are most of us on like a spectrum of like wellness to illness?
Yes. So your last comment, yes. Are we on a spectrum of wellness to illness? Yes. So like I mentioned, there's wellness. There's varying degrees of unwellness. And at a certain point, it crosses over to illness.
Yeah.
What is a mental illness. Yeah, allow me to just read that directly here. A simple way in which we can just define an illness. So the illness, a mental illness, is a health condition that has a negative effect on the way an individual thinks, feels, and behaves. So first and foremost, a medical condition, it's a disease, or as we like to call them, a disorder that affects how I think, how I feel, or how I behave. Okay, so I'm not, again, like I said, the mind is responsible for how I feel, how I think, how I behave. So when those faculties are not working the way they should, then we say you have an illness. But just to give an example, if my eyes are supposed to allow me to see, if I can't see things at a distance, my eye has a disorder, which then I need specs for, right? I'm not choosing.
Right.
To see,
not see that far.
So there's a disorder that needs to be treated.
Right.
So when you have a condition which affects how you think, how you feel, or how you behave, then that is what we call a mental illness. And there's many.
Yeah.
People sometimes think that this thing of mental illness is one big thing.
Right.
It's not. It's a whole spectrum of illnesses that can be categorized in different ways. We have this Bible, we call it the DSS, the Diagnostic Statistical Manual, that lists multiple diseases now of the mind. Yeah, so but they all really broadly, I would say, fall within, disorders of thought, of mood or feelings, and of behavior. So that's how we tell that someone is now mentally ill, because the way they think changes, right? So now if someone if you woke up tomorrow and you believe that you are the Navageriko of Uganda,
where's my crown?
Right, we would say that you have a delusion. Okay, that's a disease, that's an illness, right?
Yeah.
If you suddenly feel very, very sad, you can't seem to shake it for a long period of time, we would say you have a disorder of mood. It could be depression or bipolar, right? If you suddenly decided to act in a way unlike yourself, undress your clothes, move around, throw stones, the way you're behaving is strange, therefore you most likely have a disorder. So that's a big difference between now wellness, which we just talked about, and illness.
How does one know that they are going or they are further down on the spectrum towards illness?
Again, varies from disorder to disorder, right? So, of course, the characteristics of each of the different disorders is different. So, anxiety is different from depression, different from OCD, different from PTSD, different from, eating disorders, different from schizophrenia, different from schizoaffective disorders. All of those are very different. But I think one thing that neatly summarizes the break from wellness to illness, how we like to phrase it is, impairment in social, occupational functioning. Okay.
Yeah.
So if I get to the point where I can no longer function, right? Or there's an impairment. Let me talk about that. An impairment in my functionality, social and occupational functioning. That most likely is going to mean that you've set into illness. Right? Because it's possible to, again, struggle with the things I was mentioning. I'm not productive today, but I'm still able to get things done. Right? It's not really impairing my functionality. I'm not well, but I'm not ill. Right? But if it gets to a point where you can't show up to work, I can't take care of my kids, I
can't leave the bed at all,
then you're crossing into illness now, which has to be. So impaired social and occupational functioning would be the catch that now something is wrong. And again, it is usually a change from the person's normal behavior and persona. Right? So we know who Dennis is, we who have lived with him, we know how he does his things, we know how he lives. If we notice a drastic, significant change from the Dennis that we know to the person that we're seeing today, and on top of that, he is impaired in his social and occupational functioning, and most likely he has an illness, which then needs treatment.
Yes. We were talking earlier about how long it takes to actually go and seek help. And the fact that sometimes, with what you've described with mental illness, sometimes it's something that can be easy to hide. It's something that can be easy to be like, you know what, there's this going on, but rent has to be paid. So let me just get into, go to work. Or you're feeling like, oh, I have to take care of my kids. There's this and that and the other. So you find yourself functionally, you're ill, but you're functional. Tell me more about that.
So that's why I talk about impaired function. You're functional, but you also know you've been better. Again, you're not reaching your potential. You're not realizing your full abilities. So yes, we do have people who are ill but functioning. So the illnesses don't immediately make you non-functional. So again, they're also spectrum.
Yeah.
So you can have mild, moderate, severe illness, mild depression, moderate depression, severe depression. So people who are actually in the mild to moderate category are still functional. I'm still going to work. But even at work, the quality of work I was doing will not be the same as that which I will do when I am ill. Okay, so we can already see the change. And going back to people take long, people hide. My perspective of this is oftentimes because people don't know, right? Not often do people hide intentionally.
Right.
Because for the things that we know, we are quick to go and get help, right? Today, if you are vomiting and you have a fever and joint pain, will you try to hide it?
No. Immediately.
Get a malaria test, get the medication, because fever, joint pains, vomiting, this might be malaria.
Yes.
Right? So then I'll go because I know, right? But the moment I'm not able to see clearly, right, I'm going to go to the optician and get myself a pair of specs. So when we know, knowledge influences
action,
practice, and behavior. So I think my view is for many people, the ignorance and the stigma. So it's not, there's ignorance, the next thing is stigma. Because
we'll talk about stigma, but you see how you talked about when you're ill and you're vomiting and you have all these symptoms, it's easy to go and seek help immediately. But I also feel like it's easier for the people around you to support you. They're like, oh my goodness, you're sick. You can call out of work, you can call out of school and be like, okay, I cannot come in today. But for example, more, let's say the younger crowd, let's say the Gen Z or some millennials are like, I need a mental health day. And other people or people from older generations are like, what do you mean you need a mental health day? We all have things, we all have problems. Come to work. You get it feels like it's something that is frivolous and just,
ignorance. They don't understand it, right? And I think that's something that we are working to solve, right? By giving this information out there, because many times it's because they don't know, right? And that's why by the time they wake up to it, it's been happening for so long, right? And if we're able to identify it sooner, they would tend to it sooner as well. So it's the difference in how much we know that is informing. Like you mentioned, if you had an accident and you broke your leg, there's no boss who's going to say, why are you not at your desk? Right? It's almost understandable, right? Or take your time, get better. It's just that they have not also, and that's what we need to really do, is emphasize that, hey, this is as much illness as that guy who was an accident. Yeah. Right? This is as much illness as the guy who has malaria and is vomiting. It's on the same, they are all illnesses, all disorders.
It's funny because back to what we said at the beginning, the hardware versus software thing. When your brain has a problem and it's like, oh my goodness, there's this neurological problem, you have a tumor or something, the world stops. But then if it's mental, it's your mind and you're just not feeling like yourself again, it's easy to ignore, it's easy to brush over.
Which is wrong.
Yeah.
And that's really what we're trying to really get the word out there, to realize that they are not everyone, right? Because then people want to hide in that bracket of...
Yes.
Because for some people, they just don't want to work, right? They say, mental health day.
Lazy, what?
Which is not the same. Which is not the same. But there are some people who genuinely
they really want to do it. Yeah.
Genuinely unwell and they need treatment. Now it goes to us helping the other people to understand that, oh, yes, there are these illnesses that will not manifest with pain, vomiting, fever, but they are illnesses all the same and need to be given the same attention as the others.
Yeah.
So yes, we have to do a lot of work in helping them to realize that, oh, this is actually an illness, one that needs treatment.
Right. Yeah. I'd love to talk more about stigma because I think for the longest time, when people hear about someone being mentally ill, they assume you're walking unshowered in the middle of the street, you don't go home, you haven't washed your hair, you're, I don't know, whatever, you're mad, quote unquote. And they do not give room for any other, manifestation of a mental illness. And so even people who might be feeling it and they're like, you know what, I'm not fine, will not want to have that tag on them that they are mentally ill.
I agree with you. It's a big problem. But I think it also really goes down to ignorance, right? Sure. Because people don't know. And oftentimes when there's ignorance, again, when there's a vacuum of information, then a lot of stereotypes start to come up, superstition starts to come in, then myths start to follow up, to develop, and then, you bewitched, or you have a demon, or you're lazy. You're just lazy, right? All these are, again, elements of stigma that are fueled by ignorance.
Even the name, like Butabika, right? The hospital itself has that tag on it that people think, oh, you're in Butabika. Oh, like, it's like, oh, you're sick,
Yeah. Very true, very true. And it's unfortunate. But yeah, I mean, I know people. So I've talked to a couple of people, and you tell them. I remember when I was joining the world of psychiatry, when I thought, oh, I'm going to be a psychiatrist. Like, are you sure? And they're going to stone you and
right.
No, right? I've never been stoned. Just so you know. It's actually a very good place. Oh, Butabika. When you talk about Butabika, everyone's like, no. When I ask, how many of you have actually been to Butabika? And no one. How do you have this belief that you hold so dear? Yet you've not been there. It's a beautiful place, by the way. I don't know if you've been there.
No, I haven't.
Beautiful place. It's a hospital like any other.
Yes.
It's very beautiful, very serene. But because of the story, and again the stigma, the misinformation around it, people immediately imagine the worst when they think of it. But it's a beautiful place. It's a beautiful place, and there's good treatment, and many people cure. So the goal is to demystify all these things so that people can come quickly. And the sooner we come, the sooner we get treatment, the better the outcomes are going to be. So let's not wait 10 years, right? Don't wait until there's no other option, right? Come in early because, again, early detection means better recovery, better sooner recovery, right? So that's why we would want people to just, now be informed about the right situations, and then eventually will get better. So a lot of stigma is fueled with misinformation and superstition and the like. And we need to demystify that by giving people the right information, the right knowledge. And if that can then be spread around, we have a better chance of getting people to embrace this a lot more. I like to give the example of HIV. Right? 30 years ago, you couldn't openly come and say, I have HIV. Everyone would believe. Right? We now know it's not contagious. You won't get HIV by shaking my hand. I can work in the office. You could not say that 30 years ago. People were not coming for treatment. Again, the same barriers that I think are there now. Because of the work that has been done to demystify it and to really support people and get the treatment out there, there's a very different story today. People happily go and test for HIV. People, if they are positive, are taking their medication. I think we're already on, 95, right? 95% people know their HIV status. 95% of people who have HIV are getting treatment. So we are doing well because of the work that has gone into demystifying and giving people the right information about what HIV is, how it can be prevented, how it can be treated. And so more and more people are coming to get the treatment that they need.
Yes.
As compared to when there was no information and there was a lot of stigma. So I think for me, that's the angle we have to take with mental health as well, to get people to be able to know the real truth about the illnesses, and that will ease the community support that they probably need.
So I think one of the biggest reasons why HIV was like, I guess, given so much attention and focus and all that was because of how high the death rate was and how high, I guess, the fear was. And it was this whole thing that, you know, people did not know. They're like, what is this? What's happening? So much went into kind of containing this beast. I don't know, is there a way that mental health can also be like attain as much attention? Because at least, okay, I don't know how accurate those numbers were when you say 14 million Ugandans. But like once you see 14 million, I feel like shouldn't that be like a cause for concern? Like actually we need to put more into this.
It is. Of course, now, again, I like that you mentioned that. We have to understand that our measure can't be death. Right? Because if the measure is
very extreme
death, a lot is going to go under the surface. Because I agree, because of the death toll and all that, there was a lot of interest in HIV, and it got a lot of funding, a lot of support, and all that. But just because something is not going to kill you doesn't mean you shouldn't deal with it.
Right.
You shouldn't pay attention to it.
Yeah.
And so we have other ways in which we look at burden of disease as compared to away from just death, right? Because most of the mental illnesses will not directly cause death. There is death, suicide and the like. And it's also one of the big problems that we see. And we don't talk about it, right? It can result in death, but many times maybe not. But then, so we have what we use, what we call the days of active life lost. We call them the DALIs, right?
Yeah.
I'm not dead, but I'm not productive. I'm not active. So it's a day I've lost as a result of the illness. So there's a study that was published, this is 2016, and it was looking at, again, it was the global burden of disease study. This is a global study, not just Uganda. This is a global problem, just so you know. And they were looking at the different disorders in regards to how many days of active life lost result from those conditions. And the neuropsychiatric disorder, right, accounted for 28% of the total burden of disease of that year. More than cancer, it was 11%. More than cardiovascular disease, it was 2%. More than endocrine diabetes and the like, which was 4%.
Yeah.
You know,
that's crazy. That's insane. Yeah, that's
28% was neuropsychiatric disease.
Yeah.
Depression accounted for 10% of that 28%.
I can see that. Yeah.
Days of life lost. I'm not dead. I'm not functional. So it's a big problem as well.
Right.
But if you are still measuring, in regards to did you die,
right,
then I think we're missing the point, right? Because we want people to be healthy.
Yeah.
Wellness.
Yeah.
Then the measure can't just be, but you didn't die. Okay.
But the days of life,
so
that's something
it's a big problem.
Yeah.
It's a big problem, and it's something that we really need to pay attention to as well, because it really is affecting us.
Yeah.
Right? And it did. When the studies came out, of course, we can have many questions as who did the study, how was it done, and all those different things. And of course, at this point, they were mainly looking at symptoms, not necessarily diagnosable disease, and it was a fairly well done study. There are many critics to it. But yeah, we know that it can be as high as 30%, which is around 14 million people. The studies show that the prevalence of what we call the common mental illnesses, that's depression and anxiety, will be as high as 15 to 30% in the population. So statistically 30% of Ugandans are 14 million people who have these conditions in varying degrees of severity. But yes, that number is about right. But again, because you're not dying.
Yes.
People.
But do you know, like there is looking at the death toll according to like self-harm, suicide, But what about like people who take other people's lives? And like the reasons why? Because I've been, as someone who used to be a true crime, especially during lockdown, true crime girly down. Like I was watching all those and like the why they actually did those things and stuff like that. And you find that someone has like a mental disorder or like, it just like there's something whispering in his ear that all women need to die. So he's going to wake up every night and go and kill as many women as he can. Or whatever for whichever type of person. So like, isn't that something that would have been a cause for concern and like be like,
again, are we investigating the why?
Right.
Maybe not. No.
It's just that you did this, go to prison.
I part of our training, we had to go to the prisons as well.
Right.
There's
Okay.
people with undiagnosed illness in the prison.
That's fascinating.
Yeah. So that's also a thing, does our judicial system look out for those things?
What was the prison experience like?
Well, there are many people there who have illness.
Yeah.
Well. Yeah, because sometimes they are going to commit crime because of the illness. Which is unfortunate, but it happens. Again, if I have schizophrenia and I'm hearing voices and commanding me to do this, technically they're not guilty because they're ill, right? So there's a classification which is not guilty by reason of insanity. So if we can prove that this person was ill at the time when they committed the crime, they're not guilty. But again, people are not going to wait, right? And they're just going to abandon it.
What about like sociopaths or like, like antisocial disorders?
The personality disorders as well. There are some, but again, who has made the diagnosis?
Right.
You get it. Who has made the diagnosis? The prison system employs one psychiatrist. So who's going to make that diagnosis?
Yeah.
It's possible, but who's there to make that diagnosis?
Right.
Yeah. So a lot of that just goes.
We were talking about earlier how small the numbers are of medical personnel in the psychiatry space. Like, tell me more about that. Because
it's been one of those spaces that has, I would say, been quiet for the longest time. Been very, very few. It's getting better. So more and more people are joining. Until very recently, Makerere was the only institution that was training psychiatrists, but now we have other universities that have come on board. Bara is training psychiatrists as well. So the numbers have begun to increase. So we have a few more than we used to, which is good. More people are getting interest to pursue this line of work as well, and so it's going to get better. But I think up until about maybe 6 or 7 years ago, you had less than 50.
Less than 50. Yeah. Another number.
That number is steadily increasing.
Yeah.
We're probably looking at maybe about 100 or so now.
Oof.
Still small.
That's still small.
Still far from the ideal, but I'm happy because the trend shows that more
it's trending
and more people
upwards.
are beginning to appreciate the world of psychiatry and coming in to study to do this. Again, I think it also ties very nicely with the awareness.
Yeah.
More people are aware of this. Again, thanks to the work that you guys are doing, talking about this. People are more informed about, illnesses of the mind, and also pushing people to support their loved ones to come back and study. So we definitely will see one improvement.
Why did you choose psychiatry? Or was that your choice?
It was my choice, definitely. And not many people are very happy about it. I remember getting a lot of side eyes when I talked about it. I think for me, it was really recognizing that there was a great need that was not being met. And I've always wanted to. I joined medicine to help people and to attend to those who needed help. I quickly realized during my training that this was a space that was, very widely neglected. And for me, that's what pushed me to come and say, hey, there's a lot of work we can do here. I want to be part of the team that gets that work done. Again, the widespread, the myths, the ignorance around it, I wanted to be part of the change. And that's why I chose.
Okay.
Among other things.
Yeah.
And I love to talk.
Yeah.
I get to do a lot of that.
Right.
that aside, I saw that there was a great gap and a great need, and I thought, okay, my services would be better to use in this field.
Yeah. Have you had an experience that's like close to home when it comes to like a mental illness, maybe a loved one or yourself or something like that?
Definitely. I can confidently say all of us know someone who's battled with mental illness. Confidently. If not a brother or sister, a cousin, a relative. I mean, 30%.
Yeah.
So what are the chances?
Yeah.
You don't know anyone.
Right.
Do you know them? Were they diagnosed? There's a different issue. But you know someone who struggles with mental illness. So all of us definitely have. And I have had family that have, lived and battled with mental illness. Yeah. I mean, we were fortunate enough to have access to treatment.
Okay.
And my loved ones are better. And I think it then occurred to me how many people do not have the luxury that we did. At the time, we had access to the knowledge, and we were able to get treatment for our loved ones. Not many people have that luxury, and I want to be part of that change to make sure that more and more people have access to the care that we have.
Yeah, yeah. I mean, speaking for myself, it's something I was really excited to talk about now because I have health issues that are unrelated to the mind. Yeah. But when you are down for a long time and you are, let's say, like incapacitated, you cannot leave your house or something like that for like an extended period of time, you also get that added, you deal with that added thing, and you're unwell. It's like, just a spring again. Undiagnosed, I've not gone to anyone or something like that. But like, there's a sprinkling of depression, just a little bit, or like, anxiety or stuff like that, and you're just like worrying about all these things, and I don't know, like it's something that a lot of people will deal with and just not, go to a professional for whatever reasons. I think one of the biggest reasons that people don't do that is because of like the cost of mental health, which in my opinion, I think is like, you watch TV and you're like therapy in this very gorgeous lush room, and this person is across from you, like we have seen it in movies. So that's what you're expecting. In your head, you're like, will they be in my budget? Like, yeah.
I think, and I'm not trying to debunk, I mean, it can get costly, it's true. But there are avenues. The government does provide psychiatric services free of charge, right? Okay. At the Butabika Mental Health National Referral Hospital, free medical services, free psychiatric services are available. In Mulago at the Boston Mental Health Clinic, free medical. Okay. Free psychiatric services. Free of charge. Okay. So it's not expensive, not necessarily. Of course, if you're to get it in the private setting, then it's costly, because that's what private ultimately is. But I also like to think it's more about the need. So the awareness of the need. Because, I mean, if someone has a tumor, like you mentioned, we are going to do fundraisers. Yes. Why don't we fundraise for someone to get... We should. Yeah. Because it's an illness like any other. Right. We should be able to say, hey, guys, I, have been diagnosed with schizophrenia and I'm going to need this treatment. The way we give money for someone who needs a kidney transplant, we should be able to come together and support them. I mean, people who, now again, fortunately, with insurance coming on board, those are medical insurance, it covers psychiatric care as well. So health is expensive. Yeah. Let's not say mental health is expensive. Healthcare is expensive. That's true. Across the board, right? We need to single out psychiatric care.
I think it's very easy to like postpone mental. Rationally, like this.
That's the thing. Yeah. That's the thing. Because we don't see and immediately recognize it as an illness. Right? Because again, we see it in the movies, it's a bourgeoisie thing. So we don't recognize it as something that needs to be addressed. And as such, it takes we sort of postpone that. But if we did, then you would know that coming in earlier means you're going to have to spend less.
Right.
It's something with cancer. If you come in stage 1,
yeah, you can kick it out.
Stage 4, the cost you're going to need is going to vary, right?
Yeah.
So if you come in earlier, you'll spend much less. You come in later, we're going to need a lot more for you to be treated. So I think when we keep going back to demystifying this, it's an illness like any other. If with malaria, I'm not going to rush, right? Why? Because I know that if I don't, I should. The moment I begin to feel unwell, one day, tomorrow I'm going to go. If you came in when you're feeling a tinge of depression, use your own words, and speak to a professional, you would be out of it in the shortest time possible. And again, these illnesses, majority of them are curable.
Right.
Are curable. I mean, I've met people who've been, battling depression for years. Yeah. They probably come to the hospital for something else. And then realize, but wait, you're actually
also
have depression.
depressed. Yeah.
And I give you medication. They come back after 2 weeks and thinking, how is this possible that I've gone this entire time without knowing that I could have gotten treatment?
Right.
And the treatment is very, very effective. Right? And so, yes, within a month, someone is a total flip.
Yes. Like, I literally know people who have been depressed for like years, and it reaches a point where it's like just part of your personality, and they're like, oh, that's just
it's an illness. Once we realize it is an illness and get treatment, they get better.
Yeah.
They get better. So we don't have to remain in that slump. Yeah. There are options. There are options. I know many times also a lot of the frustration around it, even for the longest time, they want very many options. Right? Or maybe the medication wasn't readily available, or the meds had side effects. But of course, a lot of work has gone into making these interventions available and much more affordable today. So you don't have to remain in that slump for too long. The sooner you come in, you get out.
Yeah. I would love to talk about even like the other avenues people go to look for, mental health care, because let's say they are not informed and they do not know how accessible a doctor is to them. So, like, because there's been a lot of talk about like pop psychology, where like, you're seeing an Instagram carousel giving you symptoms of, anxiety or symptoms of ADHD, and you're scrolling like, wait, I think I have ADHD, or I think I have depression. And like, the social media of it all, and like TikTok, and someone is coming and they're really telling you about all these things, and they're a mental health coach, not a doctor, they're a coach. Okay.
Yeah.
So
I think they're helpful. I think they're helpful because they get the conversation started.
Gotcha.
I think that for me, in that regard, I'm very happy. I've had many people come to me in the clinic and say, hey, I have ADHD. And I'm happy
that there's a starting point.
If they had not scrolled, they would never have come.
Right.
But they've come. So I'm like, okay, sit down. Let's now do the full assessment. And then I'll come and realize, no, you actually don't have ADHD, you have depression.
Right.
Or you don't have ADHD, it's actually anxiety. Right? Or you don't actually have an illness, you're just unwell. So I think that stuff is good because it's allowed people to now begin to consider the possibility that there's an explanation for the way that they are feeling. And there is hope that they can get better. On that front, I am all thumbs up. Is it, like, can I conclude off or an Instagram reel that I have depression? No.
Okay.
It's an illness.
Yeah.
And you have to come and get diagnosed by a licensed professional who will go through a very elaborate process to determine whether you have this or that other disorder. So it's not enough to just stop at, I saw it on Instagram, therefore I conclude that I have depression.
That's a big...
But I think it's a good place to start.
Yeah.
That should get you into say, now I think I need to go and talk to someone and confront.
So from like the TikTok, Facebook, Instagram, psychology and all that people get, there's also been a shift towards more like artificial intelligence. People are like talking to ChatGPT about their problems, and Chat is coming back with possible solutions and tools. What do you think about that as an option?
It's again, I like to say it's a good place to begin. I think it's a good way to look for information, but it's not the solution entirely, right? And it's a good place to ask for information, to get some form of guidance, but it can't entirely replace the role of a trained healthcare worker.
Yeah.
Especially when it comes to illness. Here I'm speaking about people who have the illness now. They're going to have to come and see a doctor.
Yes.
I mean, you wouldn't have a tumor and go to ChatGPT.
Because I feel like a tumor, you have to physically cut it out of my body. But if it's a mind thing and I can speak, I can type, I'm let's talk it out. That's
everything
where
is going to be talked out. There's a biological element to these illnesses, right? And that's why we give medication.
Okay.
Right?
Yeah.
I didn't want to get into a lot of the biology. There are actual changes happening even now biologically, right? In the chemicals in the mind, in the brain structures themselves.
Right.
So if I showed you an MRI PET scan of someone who has severe depression and someone who doesn't have it, there are actual changes.
Oh, really?
This is an illness.
Right.
It's a biological condition.
Yes.
We really have to fight not to trivialize this. Because that's what then leads to the problems. And that's why ChatGPT is not going to solve it, right? I mean, there have been cases now, actually. Recently, ChatGPT was the company that runs ChatGPT was sued.
Yes.
Over a child, a young fellow who committed suicide.
Yeah.
And because ChatGPT told him, this will you need to end your life.
That number is up to 4. There have been 4 AI-assisted suicides. That's way too much.
Of course, AI is not a trained doctor.
Right.
Again, yes, it is intuitive. I'm not an expert in how it works. But it's not a trained doctor. And
it also tends to agree with you so much.
Because it's designed that way.
Yes.
It's designed
so you'll be going through a delusion and the example you gave earlier, it's you wake up in the morning and think that you're the queen. It will be yes, the queen that you are, you're supposed to do this, you're supposed to do that. And it actually fires that flame.
It's not designed for that.
Yes.
It's not designed for that. But it can't in itself treat you.
Yeah.
It's not designed for that purpose, right? It's not designed for that particular purpose. So you still have to come and get a diagnosis, an accurate diagnosis, and an accurate treatment plan for you to be able to get better.
Yeah. So now that we know there are people who will come to the doctor only when they have reached that dire place, what would you suggest for people who feel like they're unwell, feel like there's something that needs to be changed or looked at? What is the course of action for them?
Well, we have a very nice saying, I think, better safe than sorry, right? So it does know how to check, right? One of the things, it is recommended to go for a physical checkup every 6 months, right? That's the current practice. Go for a checkup every 6 months. But don't just check your physical body. Remember what I talked about at the beginning, right?
Yes.
Health.
Yes.
Physical, mental, social well-being. So if you're doing a physical check, do a mental check as well.
Yeah.
And fortunately now, the resources are becoming more and more available, right? So you can walk into a hospital like Rubaga where I work, and you'll see a physician. Also, schedule to see the psychiatrist as well. Just do a check. If there is something, then we get it fixed.
Yeah.
If there's nothing, they will tell you there's nothing.
Right.
And you're good to go.
Right.
So why run the risk? Why run the risk of there being something and you don't know about it?
Yes.
Rather, go check. So if you're not sure, go and check. Go and check. And if there is, the sooner you get it, the better.
Yeah. Earlier we were talking about what it would take to actually reach that point of knowing, okay, you need this, you need that, you need the other. I had the mindset that, you needed to have this whole, background and, have like all these like 4 or 5 sessions where you're talking about, everything that has happened and every trauma. And it's like, before you get to that point of like, okay, now you need, a mood stabilizer or you need this or that. So like, does it need that much?
Nah. Nah. I mean, if it's, of course, again, like I said, there's a whole battery of possible illnesses that someone could get. But again, when you go to see a professional, they will, very quickly run an assessment. So there are standardized assessments that we do, and then we will easily tell that, okay, you have this or you do not have it, right? And yeah, you don't need 5 sessions,
right?
To begin with.
Can someone come in and just get like tools, coping mechanisms, and like be like, hey, I'm like, they're depressed or they have depression, and they're like, okay, I need tools on how to like actually cope with this instead of going and reaching for like drugs or something like that. So can you like come in and learn that?
I'm unwell and I'm ill. Okay? If you are ill, you need treatment. Now, the treatment will vary depending on the severity.
Right.
So if you have severe depression, you need the treatment.
Right.
Okay?
Yes.
The treatment is standardized protocol that we follow to treat the illness. Okay? If you're unwell, okay? So like you don't have an illness. I'm not okay. I don't have the illness, then there are many tools that we're happy to share.
Okay.
Right? Technically speaking, you don't even need to come and see the psychiatrist.
Right. Okay.
Because I'll very clearly tell you don't have an illness. And I'll give you the tools that you need, right? It's like if you came to the hospital because you thought you had malaria, then you ran the test and they tell you, no, you don't have malaria. Would I give you medication?
No.
But I'll give you mosquito net.
Yeah.
Like, okay, yes, you don't have malaria, but here's a mosquito net so that you don't get
dehydrated. Go and drink water.
Or drink water.
Yeah.
Or exercise. Or, depending on what we find. Right? Yeah. So we're not just out there dishing medication.
Right.
No. But if you need it, we will give you the medication. Right? Because our mandate is to treat. And if there is an illness, it needs to be treated. There's no shortcuts.
Right.
You can't say, oh, I have depression, meaning I'm ill. Again, feeling sad is not being depressed. The two are different things altogether. If you're depressed, the illness, you can't come and say, okay, no, just give me tools. No, it's like you telling me, oh, yes, we've tested, you have malaria, just give me Panadol. You have malaria, you need anti-malarial. Yeah. Right? So if you have depression, illness, you need antidepressant.
Right.
But not everyone has depression.
Right.
Statistically, it will probably be 1 out of every 10.
Right.
Or 3 out of every 10. Right? So if 10 people walk into my office, they're not all walking out with medication. To be 3 of those.
Gotcha.
You get my point? For the others, it's probably, you're unwell.
Yeah.
And you just need to do A, B, C, D.
Yeah.
And you'll be fine.
Dr. Agaba, that has been a very insightful conversation. I hope it doesn't stop here.
It doesn't stop here, but I think it would be good for us to have what we call the big 5. That are really meant to be practices that we can all incorporate to help keep our minds healthy, right? Keep them well. And again, this is for I'm unwell.
Yes.
And how do I get well? This may not necessarily work for people who have illness, because those will need treatment. Okay. So big 5, right? Number 1, sleep. Okay. The adult human being is required to sleep 6 to 8 hours every night. Okay.
Right.
I like to add that sleep is not a luxury. It's a biological need. Okay. So you need to sleep. Most of us nowadays
sleep late, wake up early.
I'll leave it there. But you need to sleep. If you want your mind to be healthy, get 6 to 8 hours of sleep every night. Number 2, eat healthy. Right? It hasn't changed. Balanced diet, proteins, carbohydrates. Eat healthy because again, it's that which fuels the mind.
Right.
So it's important that you have the right resources, the right nutrients for your mind to be healthy. Also to drink a lot of water, which is key, right? So part of diet is the food that we eat and also that we drink enough.
Okay.
Number 3, physical exercise.
Okay.
Right? So the gym, the gym zone. It is very, very important to get at least 30 minutes of physical exercise every 3 or 4 days. 3 or 4 days in a week. 30 minutes of physical exercise. So it's very, very healthy for your body, but for your mind as well. Right? So we really encourage that we all get physically active.
Yeah.
And exercise in this context, is activity that gets you to pant and sweat.
Okay.
So I walked 10,000 steps. Not necessarily count as exercise.
Really?
I was just walking to,
around
the desk across me, then I walk on the side. That may not count as much, but at least 30 minutes of
like a hike, maybe.
Yeah, like a hike. At least something gets you to pant and sweat. 30 minutes. Yeah. That is significant. That's good exercise, right? So exercise, sleep, diet, right? But then the 4th is what we call meaningful relationships.
Okay. Interesting. Yes.
Meaningful relationships. Right? Yes. It's not so much about the quantity, but the quality. Like, do you have people that you can sit with and talk about the real stuff, right? Not ChatGPT. But like, people that you actually sit with and you talk.
Yeah.
Talk to people who know you, who you are, who know what's going on with you. Right. It's very therapeutic, very cathartic to talk. Right, man is a social being, and there've been studies on brain activity when you're alone and when you're with people that you care about, that are your friends. Yeah, and you see great spikes in serotonin levels, in dopamine levels. Right, you meet an old friend, feeling because you just made this person. Absolutely, and spend 30 minutes with them. It's very helpful to create and sustain meaningful relationships. One of the great ills of the social media era is it's made us lose touch with the ability to maintain real friendships. Right. You have 5,000 followers, but how many of them know that you had a bad night last night? Yeah, we only post the good stuff. Yeah. Right? How many people know that I was crying just right?
I don't even want to get into that whole space because you feel like you're connected to all these people and whatnot. But like sometimes connection goes only as far as like, oh, I saw they posted, so they must be fine. Like I've been seeing this person around. They're good. They're kawa. But
stop and have meaningful conversations. There's a nice article in the New Vision a short while ago, and I think the heading was, "How are you? I'm fine." Is killing people, right? Because the typical thing, "How are you? I'm fine." Are you fine? How many people actually
go the extra mile
to say, "But how are you really? What's going on?" Right? This guy is struggling. He has no fee. Bambanja, they're taking the house. And you ask him, how are you? Are you fine? So meaningful relationship, right? A meaningful relationship with yourself. How often do you stop to reflect on how you're doing? Right. Like, how am I? How am I? We have all these targets at work, and all these KPIs. Do I have the same for myself? Am I okay? Am I well? How am I feeling today? Yesterday, do I have plans for myself? How am I doing with those plans? How am I dealing with the adverse situations I'm dealing with? So sometimes we're so busy fixing the problem in the world that we don't stop to, just double check how we are doing. So meaningful relationships with others, with yourself, very key. With God. For those who believe, it has been shown to be very helpful, protective, and helpful for your mental health if you believe in a higher being, right? So many studies have proven this. So very helpful as well.
Yes, so the last pillar?
Yeah, number 5 is purpose. Purpose. Right?
Having a why.
Find your purpose. Find your purpose. Why do you wake up every day? Why do you go to work? Why? What's that thing that's bigger than you that you believe in, that you are giving yourself to? That's also very helpful to help you navigate through life and to be healthy, to be mentally healthy, or mentally well. Right? Yeah. So those 5 are very helpful, and that will really help you cope with most things.
Yeah. I feel like that's a lot that we can, think about, and a lot of action points that I think can take home and just kind of either review or like adjust and stuff like that. And I think it would be really important for anyone who feels like they might need just to see a doctor, just a checkup, like just like how you go and check your eyes, just make sure that everything is A1. Go and have a check for your mind. So yes, thank you, Dr. Agaba, for having me. Time and yes,
I look forward to coming again.
Oh yeah, you definitely need to come back. We need to get more into this because there's so much more that we need to talk about. All right then, everyone, thank you for watching. See you next week. Bye.
Camera speed. Sound production, take 1.
Guys, we're ordinary people, eh? And which is very interesting. When I remember at the university, I was at Macquarie. And for me, again, like I said, I've always been the one who doesn't conform. So I was never the kind to spend all night in the library. No, we'll go out and have fun. So I have friends that they couldn't believe I was doing medicine. They were like, no, we are with you every weekend. How are you a medical student? Like, no.
Yeah.
And I'm like, guys, till you graduate, I said, you mean you actually? Guys. I like Kenneth Mugabe. I've at least been to his shows. My wife loves Rema, so we go. If she's performing, we go. Yeah, I like to travel. I like to swim. Guys, we're ordinary people, eh?
If you like this video, there's more where that came from. You could check out this video over here or even the channel itself to see what else is there for you to watch. Okay, see you next time.